obviously we're talking in the previous slides about the digital shift and the work that we've completed for NHSX in the survey. I'm going to talk now through some of the potential wider impacts of the digital shift on telecare services. So more focus on what it means for services and how they're delivered. I'll stress that this isn't an area that we looked at explicitly for the NHSX report. So I'm talking here kind of with a Farrpoint hat on and nothing to do with kind of representing anything that kind of we've recommended to Department of Health or Social Care or anything like that. I will also kind of stress, and it's not a get out clause right at the start, that this whole area of kind of the wider impact of digital, I think is very much a work in progress across the industry. So I'll highlight some of the impacts that we've seen as part of the work that we're doing, working alongside telecare providers implementing this technology, but it is a complex area. I'm not pretending that this is kind of an exhaustive list of some of the impacts, and I'm also not claiming that we've got all the answers yet to some of these. So I think just be absolutely upfront and honest about that before we start. So this is very much kind of an ongoing kind of process to develop the answer to some of these wider impacts, but hopefully still useful just to kind of highlight some of the areas that we're looking at. So if you go to the next slide, please, Kate. So just to start, I'll outline some of the high-level steps that organizations are taking or should be taking when they're moving across to implementing and using digital technology. A lot of the work at the moment is focused around the first two steps that are listed here. Organizations are still very much trying to figure out what the impact of the digital shift is on their service, what they need to replace, what equipment they need to replace, how they're going to buy it, how they're going to pay for it, and then going through the process, the long process of actually then buying it and implementing it, rolling it out, putting it into people's homes, etc. So a lot of the work at the moment is focused on those first two steps, and a lot of that work is quite technology focused. It's very much down into the bits and bytes of kind of the technology and what needs to happen. But I think that's probably necessarily so. I really can't understate how much of a big change the shift to digital is for the telecare industry. This is an industry that has been using largely relatively basic technology for the last 30 years, pretty much unchanged. And with the shift to digital, they're being hit with a load of issues and concerns that they've never had to face before. So concerns and issues around what do you do about internet connectivity? What does the fact that I'm now connected to the internet mean for cybersecurity and data protection? You've got a digital service that needs regular software updates and things like that. And these are all issues that the sector has never needed to face before. So a lot of this work in these first couple of steps is technology focused. That's sucking up a lot of the kind of people's attention, which means in a number of cases there's been a lot less kind of attention paid to how you actually bring the service into operation. So once you've got the technology, how do you actually live with it? What does it mean for your operational processes, your staffing, your skills, etc., etc. What we are seeing is a number of the organizations that we're working with are now starting to get past a lot of the work in those first two steps and are now looking at operationalizing telecare, and they really are starting to appreciate some of the kind of the wider impacts and that this technology does have on how they need to deliver their service. I'll talk through that in the next slide, but just briefly, just to finish these steps. Once people have the service, it's in and running, it's kind of bedded in, and they know what they're doing. Understandably and rightly, they're looking to say, where do I go next with this technology? What do we do about transformation? How do we make best use of the technology that we've invested in? I'm not going to cover that in this slide deck, because I know Tim is talking about the where next question in his slides next, so I'll leave that stuff for him to cover. But what I will also cover in these slides is some of the work that's happening about risk mitigation. So this is a task that's happening in parallel with some of these other tasks, and this is looking at the short-term impact of the shift. What impact does the shift have on service users, and how do we keep them safe during the process of moving from analog to digital? So I'll talk about that at the end of these slides as well. So if you go on to the next slide, please, Kate. Thank you. So when an organization introduces digital technology, it has a range of impacts on a number of different areas of their services and how they're delivering them. A lot of these impacts are due to the additional complexity of the technology, but also, and probably largely, even more so, around the fact that these systems are just generating more information, and that information is coming at the service provider a lot faster. So this is information about service users and also around the operation of the system itself. And as I say, this has a range of impacts. I thought it was best to try and illustrate some of these just using an example. And the example I am going to use is around equipment failures. And that does sound like quite a technical thing rather than a service thing, but bear with me on this, and I think I can illustrate why it has an impact on kind of the wider service. So equipment failures, the way that equipment failures in the current analog world are identified is that the devices in people's homes are programmed to make a test call into the alarm receiving center, and those test calls come through once a week or often once a month. So if the test call comes through, the alarm can make a call and everything's fine. If the test call doesn't come through, then someone realizes that hasn't happened and that there's a problem, and they can send someone out to investigate it. So what that means in practice is that an alarm might be not working for in some cases up to a month before somebody realizes and can go and do something about it. With the digital equipment, it's always connected to the network, it's always on, and what that means is that these devices send regular pings, or sometimes called heartbeats, across the network to say, I'm here, I'm working, there's no problems. If they stop coming through, then the service knows that there's an issue with that alarm device. But because they're coming through a lot more often and a lot quicker, you're potentially identifying within minutes that there's a problem with the alarm and the alarm isn't working, rather than previously it could have been a month before you realize that. So clearly that's good. You realize that there's a problem, but that does have a wider operational impact. This is information that didn't exist previously. So this is coming through to an alarm to a telecare provider. You have to have then staff available and trained in order to receive this information. In some cases, this information comes across from different alarms in different places, so can potentially be spread across 2 or 3 systems. So you've got staff need to be trained on 2 or 3 systems. There's also the question of, if you do identify that there's a problem with someone's alarm, what do you do about that? and there's a risk-based decision needs to be made in terms of how you respond when you do know that there's a problem with an alarm. Some of the providers we work with, if they get a notification that an alarm isn't working at 2 a.m., we'll go and bang on someone's door at 2 a.m. in order to replace that alarm, because they say it's a risk if we don't do that and something happens subsequently. There's other organizations that we work with that have made a different risk-based decision, and in that example, the 2 a.m., they will wait until the next morning before they go and fix that alarm. Or in some cases, if it's a failure over the weekend, they will wait until the next working day before they go and fix it. So they made a different assessment based on their assessment of risk to the service users about how they're going to respond to that. And that's something that each of these organizations will need to do. This information on the alarms and their operation also raises some kind of staffing and commissioning impacts as well. As I said, this is information that didn't previously exist, or certainly not in the volumes that it now exists. So there's a question of the staffing required to actually receive this information and the training, as I mentioned before. Also, if an organization has a commissioned service, if they've got an external organization responsible for answering calls on their behalf, it might be that those arrangements were put in place pre-digital and don't explicitly say who is responsible for monitoring that alarm information. So there could be a need for a discussion of renegotiating some of these commissioning agreements, just to be absolutely clear on who is responsible for monitoring and responding to this information, as I say, that didn't previously exist before. I think the final thing on this slide, and again with this example of the failures, is when you do get a notification that there is a problem with the system, how do you actually fix it? Who is responsible for fixing it? In the old world of analog telecare, things were relatively simple. The technology was simple, and you kind of knew what you needed to do. If it was an alarm in someone's home that failed, you put a new one in. If it was a problem with the alarm receiving center, you had a supplier that was fully responsible for that you could call up and get to come and fix it. So it's quite clear on how problems got fixed. With digital telecare, there's a much the systems are more complex, and there's a much wider range of suppliers involved in providing the various bits of the jigsaw that go together to make a system. So you've got internet service providers, potentially a different provider for the home user and for the alarm receiving center. You've got firewalls and who manages them. You've got potentially mobile network providers. You've got internal IT infrastructure and IT teams. You've got different versions of software, hardware. So it's a much more complex picture, which means that when something goes wrong, there's much more scope for finger pointing between your suppliers. And what that means is that it's more likely that telecare providers are going to need technical skills, or a degree of technical skill and understanding, in order to triage problems when they go wrong, when a system goes wrong, in order to try and identify what the most likely cause is, and so who's they need to call to come and fix that. That is skills that in a lot of cases won't necessarily be available within telecare teams at the moment. Some of the organizations that deliver telecare will have internal IT teams that are likely to have those skills, but they're often not available 24/7. So again, there's the question of what happens if there's a problem with the system in the middle of the night, who comes out to fix all of that. All of these issues around complexity are compounded by the fact that the digital telecare market is still quite immature. A lot of the equipment and the support processes that suppliers use to fix that equipment are still developing. And if we're honest, there are some solutions on the market that aren't very good at the moment. They're complex to use. In some cases, they're not particularly well integrated with other bits of telecare, which means that information can be spread across a number of different kind of systems, meaning you've not got a kind of a full picture when problems happen. So all of this is kind of compounding some of the complexities around how you actually monitor and manage and keep these systems running in practice. Next slide, please. That last example was obviously quite focused on kind of a technology example of how that impacts on the wider organization. I thought just briefly it was worth looking at a more forward looking example, and I won't go into this in a huge amount of detail again, because I know Tim's talking about the kind of the where next question, so I don't want to tread on his toes. But looking forward, again, what's happening with telecare and tech, you know, there is general consensus that we're all looking to get a wider range of information on service users' health and well-being, using a range of different devices, both in the home, smart devices and telehealth devices, and IoT and various other technology, and also when people are out the homes in terms of wearables. So what this is going to do is obviously provide a lot more data on the service users, a lot more insights that's going to enable us to deliver preventative and proactive care, etc. So all positive and all good. The wider impact of this on services is around what do we do with all of this data and how do we respond to it. Telecare services at the moment are often quite alert based. You get an alert coming into an alarm receiving center that maybe a smoke sensor is triggered or someone has fallen, and there's quite a well-defined response to that alert. Obviously, with all of this information coming in from a range of different sensors, we've got a much more kind of granular and nuanced picture of what's happening with the service users. That's going to need a more granular and nuanced response to that information. Likelihood is that response is going to be provided by a range of different organizations across health, across care, around community groups and carers, etc. So there's a range of responses there from a range of organizations. So there is a need as part of the planning for putting this technology in to think about this wider impact and make sure that it's considered in terms of answering questions like who is it that's responsible for monitoring this information and picking up when a response is required, where a response is required, what is it, and who provides it, and also around the complexity of when there's a range of organizations potentially providing this response, who is it that's coordinating all of that activity. As I said right at the start, I don't necessarily have all the answers to all of these questions, but it is certainly something that these kind of questions need to be considered as part of any planning for kind of more technology being used in health and care, and in a number of cases we've seen maybe sometimes it hasn't had the attention that maybe it should do. On to the next slide, please. So just bringing things back to the present, and I'll briefly talk about risk mitigation. As I say, this is work that is happening right now, and this is looking at what short-term actions need to be taken to keep service users safe during the process of moving from analog technology to digital. And this is recognizing the fact that 2025 and the end of the kind of the rollout of digital phone lines isn't that long away. And we need to be honest and say that the likelihood is that we will not have moved all service users across to digital telecare solutions by that time. It's just looking increasingly unlikely. That potentially means that we need to look at the risk to service users. We need to understand what that risk is. We need to understand what the risk is of failed calls around the technology, what technology is reliable and what not when connected to a digital phone line. And we need to understand what that risk means to service users, which service users are most at risk, either or both because of their care needs and vulnerability, and also because of the technology in the home. We need to have processes for identifying these service users and then making sure that they're prioritized in terms of rollout of getting digital equipment to these users before others. And we also need to look at mitigation. If one of these high vulnerability users is migrated across to a digital phone line tomorrow, which is possible, what are we going to do about it if that impacts the reliability of their current alarm service? We need to have mitigation in place. Not all service providers, telecare service providers, currently have a digital service ready, so they're not in a position to be able to go out to these users and put a digital alarm in tomorrow. So in which case, what is the mitigation we can put in place to keep the risk to those service users to an acceptable level? There are things that can be done. It's just a matter of having the plans in place in order to make sure you know what they are and that you're ready to do it. This kind of whole area of risk mitigation is a particular area of focus within the sector at the moment, and within the action plan that's been developed by NHSX. There's a range of organisations looking at this, both on the technology side within the telcos, and also people like the TSA are completing analysis into what the risk of failed calls is and things like that. Next slide, please. And I'll just finish off with a wish list, I guess from myself. I've outlined a range of impacts here that technology is going to have on service providers. All of these impacts are absolutely addressable. They're fixable. We can find solutions to these, and there is work currently ongoing to address a number of these kind of impacts. But it is going to take effort both from suppliers and from the wider kind of technology providers within the sector. I guess the ask is around developing good practice around how you live with this technology once it's in, the impact of it on your service and how you deliver it, and that's looking at operational processes, what it means for risk assessments, how you respond, working in partnership with other organizations around the responses, etc. As I say, there's organizations starting to develop this best practices as they're getting past the process of implementing technology and starting to work out what they need to do to live with this. So it's a matter of developing that and sharing that best practice as it's delivered. And the other area is around future technology developments and just making sure that some of these wider impacts are really built into the planning from day one. Often they're not. You see people talk about, we're putting 5G or IoT or something like that into care, and it's great, but often you can see that there's quite a focus on the technology and not how you actually kind of then live with the service to ensure that it's sustainable. And as I said, the technology suppliers need to play their part as well. Key is just the solutions maturing to make them simpler to use, more reliable, and more user-friendly. Slight techie point, but we need to use more open standards and make the kit more interoperable so that we've got data in one place and more easily accessible. And the final thing is about learning lessons from outside of telecare. It does feel sometimes like the telecare sector is reinventing the wheel. and in trying to come up with solutions to some of these wider impacts. A lot of them aren't unique to telecare, and the industry really should kind of be looking outside of the sector to learn some lessons from what's happened elsewhere in terms of addressing these kind of issues. And I will stop there. Thank you.